So back in 1997, I had the privilege of working for a company called Physicians Online, and the company enabled doctors to post questions to fellow doctors via this thing called the World Wide Web. And I remember quite clearly looking over my medical director's shoulder during my first month on the job and seeing this case about a 17-year-old overweight girl suffering from chest pain and shortness of breath, and she was living out in Iowa. And underneath the treating physician's post, describing the symptoms and test results, was a number of responses from physicians all over the country. And they were offering their advice and insights based upon what they'd seen on similar cases. And it was truly inspiring to see the power of collaboration, the power of communication, and what those platforms had and how they had such a profound impact on a patient's life. So the theme for today's webinar is communication and collaboration, and we're going to explore how social media in particular can positively impact patient care. And to put that theme into more context, I think it makes sense to briefly describe Best Doctors and what we do for those of you who are unfamiliar with us. We provide a popular health benefit for large employers around the globe, and they hire us to assist their employers in finding solutions for sometimes complex clinical cases, and we tackle those cases through a collaborative process that involves multiple physicians in complementary disciplines. And to support that patented process, we identify the best of the best specialists around the globe through peer polling, and these are our best doctors. And what we want to do during a webinar like today and webinars in the future is to tackle relevant topics tied to how clinicians can most effectively utilize collaborative processes and tools to improve patient care. So starting in 2012, we're going to try to do monthly interactive educational programs, and I'll be asking you at the end of today's session through an online survey what types of topics you want to be covered in future webinars. And our events will be never sponsored by pharmaceutical or medical device companies, and they'll always be free for our best doctors. And it's one of the ways we want to support our physician community at large in delivering that right diagnosis, right treatment. So today is our first foray into introducing ourselves in this manner and asking you how can we support you better. So here's how the rest of the session is going to work. First off, you're in listen-only mode, and for some reason we were at the beginning of the session. And that's because of the large size of the audience. We have over 80 people on the call today. It has to be some sort of record for a physician webinar on social media. And I'm going to introduce our panelists in a moment. We'll jump into a lively discussion, and throughout the session, we'll try asking you some high-level questions, and we'll try to work that out on our end. But we'll post some what we call polling questions. And for example, we'll be asking you, do you use Twitter, or do you use Facebook? And we'll see if we'll show you the results of those questions. And incidentally, what we'd like you to do throughout the session is also ask the panel questions, and you could do that on the right side of your WebEx console through the Q&A module, or if you're using Twitter right now, you could use the hashtag BestDoc. You've seen that on some of our slides, and for those of you unfamiliar with Twitter, that's just a way of indicating a topic that everyone is following, and it's a good way to communicate with each other. So use that hashtag BestDoc to ask us questions, and we'll try following that. So the objective here is to stimulate a discussion around how physicians can improve patient care through online collaboration, and that could be whether it's physician to patient or physician to physician. And examples of these platforms can range from a simple listserv to a website to an online community, just to name a few. And I know Deloitte Consulting, they recently published a study on what tremendous value these platforms have had to healthcare organizations' businesses, but they've also provide incredible value to physicians who are the providers of the care, and of course the patients. So to talk about how physicians are actually incorporating social media into their profession rather than ask some fancy consultants in fancy suits, I've decided to bring together three tremendous physicians with fancy suits to join us. So first I'd like to introduce from Westchester Medical Center and University Orthopedics, Orthopedic Surgeon Howard Lux. Howard is a certified social media fanatic who blogs, tweets, and produces his own videos. He's also an associate professor of orthopedic surgery at New York Medical College. So Howard, thanks for joining us. And welcome.
Well, appreciate being here.
And from the Family Practice Center of Salem, Ohio, let me introduce to you family physician and social media enthusiast Mike Siviglia. Mike is the first of our two Mikes on today's panel. In 2006, way back in 2006, Mike #1 here started the Dr. Anonymous blog, and then in 2007 launched his now very well-known podcast. He now calls both his blog and podcast Family Medicine Rocks, and you could Google that. He's all over the web. Just recorded, or recently recorded, his 200th podcast. So welcome, Mike Siviglia.
Yeah, good morning. Great to be here. I'm really enjoying my suit here this morning. So,
From ProHealth in Waukesha, Wisconsin, I hope I got that right. I want to introduce to you hematologist and medical oncologist Mike Thompson, aka Mike #2. He did his fellowship at MD Anderson. He also has a PhD in pharmacogenetics, studying how heredity changes one's response to drugs. In his spare time, he's immersed himself in digital and social media. He's the one of the founding medical experts at HealthTap. He's a member of ASCO's Integrated Media and Technology Committee, and he's also one of the more active medical oncologists, I dare say the most active medical oncologist in all of Twitter, and certainly our token panelist from the Central Time Zone. So a very early good morning to you, Mike.
Good to be here.
So let's jump right into it here. Question 1, Howard, I'm going to start with you. It's well documented now for years how physicians are leveraging the internet to access information, but that's one-way cultivation of information. Where engaging in two-way communication is quite another thing. And the American Medical News just published a study that cited a number of different trends. And to me, one of the more interesting stats was that over 25% of doctors collaborated with peers as a result of their information searches, and almost half of them referred patients to a website. So we all know how time-consuming interacting with others online can be. Why, as a busy surgeon, have you made a commitment to social media?
All right. Well, first off, thank you for having me here. It really is a pleasure to be here virtually, and good morning to all of you. The world of healthcare, to me, is inherently siloed right now. It's geographically fragmented and prone to poor communication and collaboration. Today, as physicians, we're trying to solve problems via traditional methods that are costly, inefficient, and frequently not contextualized nor timely. And I felt that social media, as I started to dive in, offered me the tool sets that were necessary to change this. My initial foray into social media was simply patient-centric. It was unidirectional. I was focused to provide my patients with meaningful content and some basic ways to interact with me. As things evolved, I started to communicate and interact with them, and digital technologies and as the platforms available evolved, I layered on that technology to improve my ability to communicate with my patients and also engage with them and allow them to engage with others in my office to make their experience much better than it was previously. Then, to reach your question, I started to look towards the professional opportunities in terms of collaboration in education and in the world of continued medical education. Upwards of a few thousand articles are published every day, and we all know that technology is advancing at an incredibly rapidly increasing pace. There's no way that each and every one of us can expect to know everything within even our own little subspecialty. And we may have questions within our own specialty, or we may have questions with a complex patient where an issue overlaps with another subspecialty. So there's obviously a strong draw to utilize social or digital technologies to enable us to collaborate more effectively and more efficiently. to share their timely, relevant solutions, not only to improve our own knowledge base, but to assist our patients, improve the quality, effectiveness, and more importantly, the timely nature of the care that we can offer them. There are a lot of studies that are coming out, including one out this morning in the Wall Street Journal, which talked about how the collaborative care initiatives initiated through social media platforms improved upon our ability to care for patients in a timely, effective, and cost-efficient manner. And in my own world, I've done virtual surgeries in Pakistan through Twitter. I've collaborated with a number of physicians around the United States to improve the care that they offer, whether it be orthopedic related or not. So that is currently how I've extended my use of digital media in the professional realm.
So, and great, Howard. That was terrific. Thank you for that. And Mike Siviglia, as a family physician who sometimes, what do you see, like 3 dozen patients in a day? I mean, how do you find the time and why?
Well, I mean, I'm using social because I really think, and when I talk to physicians, I mean, our patients are really going to be pushing physicians to use social media. Every day in my office, I get information from patients on this website or that website, and it opens a dialogue and say, you know, is this information correct? Is it accurate? And if for anything else, it does open that dialogue with patients and say, hey, you know, how do you evaluate information? How do you evaluate, you know, where you got the information? Is it from a credible type of website? And growing up, I've always been kind of techie, so that's why social media, computers kind of always drew me. But looking into the future, you know, social media is just an extension of communication with the patients, communication with peers. And I really think moving forward that physicians, you know, really need to embrace this. I talk to a lot of physicians out there; they're still afraid of it. There are some, you know, real worries and hesitations about it, but I think physicians should, you know, at least start becoming familiar with it, if for anything else, because our patients are going to be pushing us to use this technology, to use websites, and to find out what the best information is out there for patient care.
Great, and we're just through. We're going to throw our first polling question up in front of all of you. If you could see in your bottom right-hand screen, yeah, a lot of people are already answering. We'll try to push out the results live. And there's a reminder to everyone that there's a Q&A box about 2 or 3 up from the top when you want to pose questions to our panelists. So Mike Thompson, how about you? Why are you making the commitment?
So I think unlike the other panelists here, I'm probably newer to the whole Twitterverse type of thing. I've always been into technology, and I think many physicians that are using Twitter or other social media technologies have been like that. And I thought Twitter was just something that kind of teens and tweens did and really didn't see the value. And I think that's what most of my colleagues still think. I think after some of the social uprisings in the Middle East and other places which utilized, at least to some extent, Twitter, I think that got the attention of a number of people. I was at a meeting down at MD Anderson with one of my old mentors, and he was on the ASCO, that's the American Society of Clinical Oncology Integrated Technology Media Committee, and he decided that he had to give a talk on it, so he was just going to sit down and learn what Twitter was about, and looked at Hootsuite and TweetDeck and all those things about how you can look at streams of information, and you see all this information going by and pluck things out, and then you can comment on things and try to share your criticism or opinions about whether it's a news report or clinical trial or whatever. And I thought that was very interesting. As most doctors do, and especially oncologists, we have stacks of paper journals, which my wife always gets me to move from one pile to another pile, and then I rip things out and then make a new pile of things I'm going to read. But I found on Twitter, especially, that I can find something that's very timely and be able to think about it and respond to it before a lot of other people see it. So yesterday there was a new drug that was approved for myelofibrosis, and I knew it was in development, but I didn't know that was about to happen. And I printed off the prescribing information and the FDA news feed, and I saw one of my patients with myelofibrosis, and I was able to tell him, hey, I just saw this. We can talk about it later when I see you, but I'm on top of it. And I think for me, being MD, PhD with previously doing lab research and still doing clinical research, I want to know what the new drugs are, new targets, and know what people are talking about. So I find it very helpful to keep up on information. I have not really been engaging in one-on-one communications with patients, and I'm still trying to figure out if or how to do that. As you mentioned, I've gone on to HealthTap, and I was one of the, I think, the first oncologists. It was mainly initially pediatricians and OB-GYN and family practice, and I found that that was a nice way to answer general questions to people in a kind of shorter format that is bite-sized information. I like that format. I also like LinkedIn for keeping track of contacts. That could be for clinical trials or friends around the country. And I've tried other social media tools, but I think we'll probably get to that later.
Thanks, Mike. And there are, I'm going to actually jump right in because there is a good question. There's a couple of good questions that have just come in. So could you comment on the following, and I'll start with you, Mike. This one attendee says he's concerned that adding social media to his tasks are going to add hours to his time commitment. It certainly won't make us more efficient or cut down or take away time from our families. So what's your comment to that?
Is that for Mike T?
Yeah.
So, I was at this Mayo-Reagan social media summit, which you were at, and I think some of the comments there were that the people that are going to do this are already into it. And trying to convince someone who is short on time to do it is not probably going to be a useful way to try to convince people. I think it's going to be people that are already interested in being on the frontier of technology and communication that are going to do this anyways. So that's number one. Number two was that there were a number of examples from Mayo doctors and from the Mayo social media group where they were able to get a doctor, do an interview, and then with a professional interview, splice that into a number of short segments for YouTube or OncoTube or whatever online format, and then they had someone abstract a number of the things the doctor said into 140-character or shorter pieces that they could use to do a tweet stream, and they could also spin it off into various like microblogs and things like that, such that the way they organized it, they could take a doctor's busy time and in an hour or half an hour do something with him or her, and then get a lot of social media content out of it. So that's obviously a very sophisticated and advanced way to do it, but amenable to any organization, really. And then there were individuals who said that day after day, someone would come in and ask the same thing, and that if they spent a little bit of time preparing just a blog and a post, that they could hand to people like some information that, especially for family practice where time is so scrunched, oh, I didn't tell you about such and such, and they could hand them some information that go to the blog and see commentary on that. It actually was a time saver. I haven't really used that, but I've been thinking about how I could use that in my practice, such as talking about neuropathy or some of the survivorship issues with chemotherapy. And I haven't done that, but some of that commentary just last month made me really think about what I could do better.
It's terrific.
Can I add something to that?
Sure.
As I just put up on the stream was a link to a brief post that I had that my social media interactions and the technologies that I utilize on my website and the way the website is framed, structured, and laid out has actually dramatically improved the efficiency of my office visits with the patients. Because of the videos, because of that, the patients are more comfortable with me because I have gone through how to teach them how to frame their arguments and frame their discussion and what type of questions I'm going to ask them, they're better prepared. So you don't have that 2 or 3 minute uncomfortable period where a patient is trying to figure out whether or not they even like you. You have a situation where the patients know where you're going to go with the conversation. They have framed their discussion already within their mind. They've already come up with a list of questions. They've reviewed your content and and the videos available on your website. And all in all, what I found was a beta difference between a new patient with the same problem of approximately 5 minutes between someone who had seen my website and utilized that in preparation for their visit versus someone who came in cold off the street.
Great. So Mike, guys, unless you have a comment, I'm gonna move on to our next question, just in the interest of time. So I don't know, those of you on the call, I know our panelists know Dr. Brian Vartabedian. He's a pediatric gastroenterologist down in Texas, and he sees the value in building in social media in building a network of peers. And in contrast, Dr. Jennifer Dyer, a pediatric endocrinologist in Ohio, she uses social media to get closer and more collaborative with her patients. So, Mike Siviglia, starting with you, what different ways do you see social media and online collaboration affecting patient care?
Well, I mean, any kind of collaboration, I think, can improve patient care. And what I'm seeing with the questions here, that there's a lot of concerns and questions about patient privacy and liability and things, and those are valid concerns when it comes to online collaboration. I think it's important that then when these collaborations take place, that they take place in a secure place, probably a place that is not out there on the internet, not there to have concerns about patient information and those type concerns, but just in the general sense, you're collaborating with peers, about cases. I mean, it expands kind of your review of a case, not only in your local community, but nationally and internationally. And I think it's doesn't hurt at all to try to get as many opinions or many experts involved with the case. So I think that this concept and this idea of online collaboration, I mean, it's just extending, what we do right now in kind of our curbside in-person consultations and collaborations. I see a huge potential for this, to improve patient care and to get to the right answer of what you're trying to answer for that patient.
And Howard, how about you?
Social media, digital media, and the platforms available allow us to improve care on a hyper-local level within your own, the confines of your office and your patient base and demographics, locally, regionally, nationally, and even on a global scale. Giving patients the information that is necessary will allow them to improve their own level of care. Improving access to physicians to offer them meaningful information relevant to a complex case that they may have and may not yet know the resources available to search for is quite useful as well. I dropped back to a case I had recently where I actually helped perform a virtual surgery in Pakistan. And it was it was a local physician who didn't know how to address a certain problem. He reached out initially through Twitter. We took it offline, and from there was able to successfully address and treat a patient locally. That plays out on so many different levels all across the world.
That's wild stuff, and I'm surprised actually and pleased when you look. I don't know if you see the poll in front of you, but it looks like our audience, a lot of them are using. A lot of our physicians on the call today are using are using social media for all those things. So that's great. Mike Thompson, do you have anything to add to that?
Yeah, so it's interesting because I don't know, I haven't actually met Howard in person, but I actually spent a month in Nepal, and I remember some patients would travel 2 hours on foot with their medical records in hand to see me, and at least in that country you could get drugs without a prescription at a pharmacist. So I was often trying to deal with people who had no access to go anywhere else, and you had to deal with whatever you had to do at the time. So there are many people, even in low-income third-world countries, which have access to social media, and they may not have access to a lot of other technology, but do have access to a mobile phone or computer and social media. And I think it's a great potential way to help people. And I don't know all the networks that are in place for that or if it's happening individually, but I think that's great. I haven't done anything like that, but I could see in oncology where some of that could come into play, although much of that is requires, after you get past a certain point, requires expensive drugs. But I think that's another probably less well-utilized but interesting way to go with social media.
That's terrific. And there's a bunch of questions pouring in. I don't want to take us too off topic, but it seems like the HIPAA legal implication question is coming up a bunch of times. So I want to let's hit that right now as we hit the top of the hour. So in general, people are concerned that Twitter, Facebook are not HIPAA compliant, could get us into trouble. You know, and there's also the concern regarding just overall legal implications, maybe alluding to medical malpractice as well. So let's just quickly go around the room here and talk about that and your comments on that. Mike Siviglia?
I mean, I don't, and I think the question's usually journeying towards this way as far as do you do medical treatment on Twitter and Facebook, and I do not. I don't advise people do not, but that's where people assume when we talk about social media with patients that we're treating people over the internet, and I am not, and I don't advise people that we're not that they do. But that's a very common question that comes up, and yes, I mean as far as patient privacy and HIPAA and liability, it's definitely out there. There are definitely ways to do that differently. When it comes to a secure type of website or other types of means, but not just out there in the open, on platforms like Twitter or Facebook.
Yeah, on that, along the same vein, I do not share anything on Twitter or Facebook that I wouldn't want my worst enemy to know. I stay away from personal health information, and if a patient reaches out to me on Facebook or Twitter, I take it offline immediately. So I thank them for the interaction. I thank them for reaching out. I encourage them to continue to do so. However, I will take that conversation offline.
This is Mike Thompson. So I, like I said, haven't been doing any directed at one patient things. And I think for oncology, where it's often based not just on what a diagnosis, but a lot of subtleties of the tumor and patient, it'd be very difficult in any case. On HealthTap, where you have about 400 characters to respond, I try to be very generic about that tumor or that condition, and then direct people to talk to their medical team because everything needs to be individualized. And then there was a recent person, I can't remember, it might have been Laura Strong on Twitter, who said that most social media interactions, the meat of it ends up being taken off Twitter or off a public forum and into email or phone calls or one-on-one meetings. And I think that's like what Howard said, is that it started off as maybe an interaction with a colleague in Pakistan on Twitter, but then you turn to email, then you're talking to him, then maybe you're even doing other things, but a lot of those interactions initiate there, and some things are shared there, but then get to more appropriate confidential contexts.
Great. So I'm going to move on to question 3. Keep these questions coming. I know there's a few still outstanding from the audience, but I think we'll have some time towards the end to address them, or if they actually connect with some of the conversation that's going to ensue here. I think it stands to reason that as physicians use social media more for personal purposes, and I think the latest survey saw like 85% use it for personal purposes, that the professional use will correlate to some extent. So, Michael Thompson, provide us with maybe a specific example or two of how you've been using social media professionally, whether it be via an ASCO discussion forum, Facebook, Twitter, another platform that maybe I'm unaware of.
So I don't use Facebook for anything professionally, and even personally, I think it's somewhat annoying. But I do like interacting with old friends and relatives and stuff that way. And I found some people that's the only way they would communicate. They no longer email but post stuff on Facebook. So I know some people use that very effectively. So Anis Yunus at MD Anderson has a Facebook account, and I think is very effective for highlighting general things in medicine, oncology, and clinical trials, and I think that's great. I've only recently, within the last couple of weeks, gotten blogged. I've never done that before, and that's on the ASCO Connection blog. And just yesterday, actually, one of the comments I made on my newest post, my second one on breast cancer and obesity and diet, is going to be put in the print version. So it's kind of where the social media is getting put into print. But
sure.
I have been doing some things that way. But I don't know. I'll let the other guys comment a little bit more.
So, Howard, I love the Pakistan example. I don't know if you have a couple of others, whether it relates to your practice specifically or another example where you're sort of been advised and consulted with another physician, but I'd love to hear them.
One very meaningful way I've been doing this is interacting with physicians in the United States, specifically in very rural areas where their access to specialist care or orthopedic care is extremely limited, or the patients have to travel a long distance. So we've established a offline network, closed network, sometimes initiated through Twitter, where they will ping me about a specific issue. They'll get the appropriate permissions. They'll share the X-rays with me and the clinical history. And we have saved about 80 to 85% of those patients from needing to go and travel the 100, 125 miles to go and see a specialist. So it's very useful to the healthcare system as a whole in driving down costs, to that one specific patient, to that physician, and again, as I alluded to before, this plays out in an enormous number of ways across our whole healthcare system.
And Mike, how about you? I actually had a telemedicine slide. I figured I'd throw it up there. It was certainly pertinent towards some of the things that Howard was talking about. But Mike Siviglia, I don't want to derail you. I'd love for you to dive in specifically to your podcast and blog, if you don't mind, and tell us what you're doing with that, and tell the audience, why you're doing that.
Well, with my podcast and blog, I definitely do a disclaimer. I don't treat anybody over the internet. I don't treat anybody on my podcast. What I do with those vehicles is a lot of patient education on certain topics, whether it's clinical topics. I also interface and network with physicians when it comes to talking about health policy issues, whether it's Medicare or those type of issues, because I think that physicians need to dialogue more about that, and I think we have to find a way to present that to patients who are ultimately voters. And to have our message out there and say, hey, there are some really important health policy issues that we need to talk about, and to educate people on that. And bouncing back to the clinical side, I talk about things that are important to me, important to primary care, when it comes to preventative care, when it comes to things like flu shots, trying to address some of the things in the media that is out there that scare people. Excuse me. or that are good for newscasts as far as scaring people, trying to get what the real information is there about some of these sometimes controversial topics. So I use a lot of it for patient education, physician advocacy, health policy education, but definitely no patient care. But that's kind of how I use my kind of social media presence out there.
Terrific. And a question that just came in, and this will be open to all three of you. You could just jump right in. I mean, when you're working through a challenging case and looking for help, have you engaged other physicians outside of your practice, and what have you found to be the most effective way of doing so?
So I have an example of that, Eric. I was on Twitter and following a well-known person in myeloma, and I had met quite a long time ago this person in person, but hadn't interacted since then. And he reached out to me with a direct message on Twitter and said, "Mike, if you ever need any help on cases, let me know." And I happen to have two cases of really refractory disease in two young women, and talked to him and on email, then switched it to email again to get off of Twitter.
Sure.
And they were both very tough, and he said, no matter what, these are hard, but was able to give me some suggestions on what he would do at a very large cancer center. And I thought that was helpful, and it was nice. And you find that people are willing to help, and I think it gets back to some of the basics of medicine. We're so fractionated and focused on billing and dictating and getting all these things together, but it's fun. It kind of gets back to a little bit of the time when people just wanted to help each other, and this is a kind of democratization of how to reach out to people you otherwise might not be able to reach out to, and I found that highly useful. Even in that case, there wasn't a ton that I could have done differently, but just knowing that someone really good was there to review things, and we reached out initially through Twitter, and again took it offline, at least in the public realm. That was helpful.
Great. Howard, Mike, do you have any other examples you want to throw in?
None in particular, no.
So,
no, I mean when I do collaborations, because I'm in a small town here, and sometimes I dialogue with physicians in big centers through their kind of physician portal, which is password protected and that type of thing. And there was maybe one or two occasions that I've read that this video conferencing for the iPhone, this FaceTime, could be HIPAA compliant, and I did try some of that just to see how it would work and how that kind of platform would work if it would be something like HIPAA compliant. So I have experimented with some of those platforms.
Well, beautiful. You teed me up perfectly for our next question. So we're seeing, obviously, an explosion, right, of social applications in all walks of our lives, and driven by the emergence of smartphones, and specifically the iPhone, which I would say personally is one of the coolest pieces of technology I've ever owned. And I know I'm not alone. This is a snapshot of the registrants from today's session, and when we asked them if they use a smartphone and what they use. So obviously lots of our physicians are using them. Majority of them are using iPhones. How is the emergence of mobile technology impacting physicians, and how does this tie into social media and collaboration in general? And I'll start with you, Howard.
The emergence of mobile technology is simply enormous. I mean, for those of you who have gotten the 4S, can you imagine using Siri in the healthcare realm and pinging Dr. Watson on a difficult case or a difficult differential? I used platforms both that are patient-centric and professional. I use closed, broad-based platforms such as Doximity. I use ortho-specific platforms to broaden my own orthopedic knowledge base, such as OrthoMind. And it's mainly to open up collaborative opportunities and to improve my own knowledge base and ability to to treat patients. I've recently started to join a few communities such as My Health Innovation to communicate with other innovators and thought leaders to discover and share the wealth of knowledge that we have and that already exists, and to strategize on potential new opportunities. And all of these have, mobile applications and mobile abilities and mobile capabilities. So as we're more mobile, our ability to utilize social media will be far less office-based or computer-based. You're not going to have to be sitting in your office to do any of these things, and it's going to drastically improve your efficiency, your effectiveness, and your ability to treat your patients.
Mike Siviglia, do you have anything to add to that? How do you see mobile impacting your life?
Yeah, just briefly. I mean, I'm really I've been talking to a lot of people who are working on really good apps. I really think that 2012 is going to be the year that you really figure out how to make these apps, secure, not only for peer-to-peer communication, but communication with patients. There's a lot of apps out there, right now that are starting to do that and are starting to answer the security question. Can you put patient information into that app and it be privacy compliant? And I really think that 2012 is going to be the year where you're going to see a lot of apps, not only on the iPhone but other mobile devices out there, so we'll be able to use this not only for peer-to-peer communication but for patient care as well.
Great. Mike Thompson?
Yeah, so I think with mobile technology, where we have computers attached to our hips now, and you have access to them more often. And for me, I use a lot of tools for chemotherapy and oncology. There are physician communities that I look at, sometimes Sermo or Doximity or HealthTap, that I can now look at mobilely. UpToDate is mobile, and what I see is patients, when they get a cancer diagnosis, within 5 minutes they're on the internet. And then even if they're in the office, they might have gotten a discussion, they're going to go off and get a CT scan, PET scan, and instead of going home to look stuff up, they can be looking stuff up and formulating more questions and getting information right, while they're in the doctor's office and getting the, or in the hospital getting Wi-Fi. So I think I've sometimes heard people say that, like this 80-year-old, they're not going to be on the internet or something, which is largely untrue because we know a lot of grandparents are on the internet to check the Facebook accounts of the grandkids. But even if someone is 90 years old and blind and deaf, they have kids or relatives that will look stuff up on the internet for them, sometimes by mobile uses. And so I think we have to not only have information there, but be there, so it's not people getting their information from uncertain sources or the most popular people, but not necessarily the most knowledgeable, such as these celebrity advocates sometimes that are going off on tangents. So I think mobile is helpful for physicians and it's helpful for patients. And I think I would agree that 2012 and on, some of the applications with not just interacting to traditional media, whether social or otherwise, but actually doing applications based on mobility, such as glucose monitoring and diabetes management, such as Endo Goddess on Twitter with her application, or heart rate or telemetry. There's all sorts of applications that are being looked at, and I hope that while these things do need security and regulation, that innovation is not squashed by trying to over-regulate and over-control these innovative things, because I think there's a lot of potential.
Great. And just to connect the dots there, Jennifer Dyer, who we quoted earlier, the endocrinologist, pediatrician in Ohio, is the Endo Goddess Twitter handle that Mike was just referencing. So a bunch of questions still to go here in the last 5 minutes. We're going to definitely end on time for everyone. I know we have busy schedules probably throughout the day. This is the feedback form I talked about at the beginning. Really important, this being our first webinar, and we know we had some kinks in the beginning. We'd love your feedback. So it takes about 5 minutes to fill out. Maybe during the last few minutes here of the session, we'll ask all of you to take a look at it and give us your feedback and your insights and input into what we should be covering in future webinars that Best Doctors is going to host. So let's start. There's a couple of questions. I think it's a real testament to the Best Doctors who've taken the time this morning to attend, that they're curious and open-minded about social media in general. But there's definitely, I could sense some skepticism. You're going to hear some of the curious questions coming up. And I'm going to start with Howard for you. You're going to know why I'm asking you to answer this first. First attendee says, how do universities and hospitals and your care systems feel about you being accessible through social media? I'm not sure my university would support it.
Yeah, that's a great question. And I was, as I started to dive deeper and sort of broaden my net, so to speak, I met with both the medical school HR people as well as the people within the institution. So I was very clear and transparent with them. One of the biggest issues that we face now as physicians, and probably the reason why most use social media for personal use and not professional use, is a lack of guidance. There are very few social media guidelines out there. The ones that are out there are just starting to scratch the surface. And so it's very important that you're open and transparent with your institution. You lay down the groundwork, you set the guidelines, you set the rules, and you abide by them. And I've had no issues with it whatsoever.
Mike or Mike? Either of you
Hi, this is Mike Thompson. So there are a ton of guidelines, and I think Brian McGowan, who's following us and tweeting some things, I think has a link to, there's like over 100 guidelines. The problem is many of these guidelines are kind of legalistic and are cautionary rather than promoting and helpful. So the AMA guidelines at the Mayo Reagan conference were, kind of shown as an example of just old thinking. And I think it's the idea of some kind of common sense don'ts, and then how do you do things well? How do you do things right? How do you integrate blogging and Twitter, and how do you use Hootsuite, and how do you interact with all of these things without getting into trouble? And I think is it Seattle Mama Doc from Seattle who said that there was some quote about like 6% of physicians had some inappropriate something or other on Twitter.
Right.
But she said that's actually pretty good when you think about like the conversations at the cafeteria or in elevators and things like that. I think it's people that can say stupid things, can say it locally or on Twitter. I think it's just trying to do good with things, and I think we need not only examples of what to avoid and don'ts, but do's to try to promote the use. And regarding universities and academic centers or community hospitals, I think at Mayo and you see it MD Anderson, Ohio State, other places, they're trying to get doctors who want to do this and actually sometimes pushing them. And I think any institution which has a doctor that's interested in social media should see them as a resource rather than a liability, because pretty soon every place is going to be wanting doctors to be doing more of this. And it's just trying to do it in an intelligent, common sense way. And we'll see more guidelines. And as the Mayo guys said it for their social media, if the guidelines are static, or when you have them, it's one point in time, and they have to be fluid and dynamic and change because the social media landscape changes, and what is unacceptable now might be acceptable later. And you have to avoid things that are obvious, like HIPAA violations. But if you avoid that and say things that you don't mind other people seeing, I think those are some of the biggest common sense things.
That's great. And Mike, right before you jump in, Mike, guys, just a quick final reminder, if you could take the time to fill out that survey I have in front of you, the feedback form. Also, I'll invite any of you who are just getting started with Twitter and sort of want to get an understanding of what physicians they should be following. I have a pretty good list of docs, including the three panelists. Certainly feel free to reach out to me directly, email me, and I'll be happy to point you in the right direction on some physicians that are good follows on Twitter. Mike Siviglia, do you have sort of an additional comment to this question?
No, I guess kind of just starting off my kind of closing comments on this entire session, which I think has been great. I think what I tell physicians is that for social media, we the people at the front end, the early adopters have to show the value of social media, and the questions usually go to patient care, and I usually have people set that aside and say, we're not there yet, but there are other ways to use social media as far as collaboration, as far as finding out information in a more very quick fashion, and things like advocacy. So when it comes to social media, there are a lot of other uses. We have to show the value to physicians. I definitely understand it's a time commitment, and it's another thing to add on the day, but I think if we were able to show the value of social media to physicians, then we're going to be able to say, hey, this is a valuable tool of communication.
That's great. And final comments for you, Mike and Howard, and I'll ask you to incorporate maybe a component of one more question that was asked of us, and that is sort of how to avoid the loss of that personal touch, looking into the patient's eye, and the ritual of personal contact by getting so involved with electronic social media. So I'll ask you for your final comments and keep that question in mind as we close out here. What about you, Mike Thompson?
So, I can be presented a case, breast cancer stage these characteristics, and come up with a kind of dry response on textbook how you would treat that. But that's where the art of medicine comes in, and will not, and doctors and human beings will not quickly be replaced by robots or artificial intelligence networks, because I can instantly come into a room and get the feeling of what someone wants, what their values are and things, and people want to talk to a human being and have them integrate not only professional guidelines, medical knowledge, and what are the most recent treatments, but to integrate it with that holistically, that person as a human being, what's best for them. And in oncology, it's easy to go line to line to line of chemo, but it's often figuring out when do you give a little bit less in order to help someone's quality of life, and those things are non-binary. So I sometimes tell people, there aren't as many stick-shift cars anymore, but the clutch is either on or off, but there is that point where you're feathering the clutch and figuring out how to engage it, and that's where a lot of the humanness of cancer care comes in, is trying to figure out how to engage people and how to get that clutch in and out without herky-jerky when you're switching gears.
Great, and thanks so much. Howard, we started with you, we'll end with you. If you could, we have about 50 seconds here.
It's funny. How do we protect the personal touch of medicine? I think this is the key to increasing the personal touch of medicine. Humans are innately social. Health is social. Healthcare right now is not social. We meet with our patients for 6, 8, 10 minutes within the confines of 4 walls in a cold office, and we no longer know as much about our patients as we used to. For those of you in 50, 60, 70 years old who remember the days when you knew everything about your patients and their family and special events or anything else, social media now offers you the opportunity to get that back, to get that relationship back, and to improve your relationship with your patients. We treat patients. We don't treat MRI findings. It's not enough to sit in your office to call up an MRI and turn around to a patient and say, you need this. We need to have a better relationship with our patients, and that's what social media and digital technologies foster. One day, each and every one of us is going to look in a mirror, and looking back at us is going to be a patient. Because we're all physicians here, I could say this. We are going to know how to navigate the healthcare system. We are going to know who we're calling first, who we're calling next, what tests we're going to need set up, and how to move through the system quickly and effectively. We need to be able to create a system that levels the playing field so that our patients have those exact same opportunities, and that does not need to take place within the confines of our office all the time. And by utilizing digital and social media accordingly, then we can make dramatic changes and dramatically improve our relationship and the personal touch with patients.
Terrific. Love it. I want to actually remind folks, I will send you a copy of the presentation and those polling results that we've accumulated. You could simply just, when you take that survey, you could just request that, and we'll make sure we email that right out to you. I want to put in a special thanks to Howard and Mike. You guys were terrific. Really appreciate you putting in the time and the effort to be on the panel and on our inaugural webinar here. A quick shout out to Fatima Latim, who was behind the scenes working hard to make this all happen. And thank you to all of our best doctors and all of our friends who took the time to attend early in the morning. Again, sorry for the late delay and the late start, that is, and the technical difficulties, but it seems like we got everything in, and this will mark the end of the session. We'll definitely put on similar sessions starting in the new year, so thank you all for attending. Be on the lookout for correspondence from me on future programs, and we look forward to all your feedback. Thanks again, guys, for your time today.
Sure. Take care. Bye.
Take care.